Welcome to KJR SummaryCast, audio summaries of peer-reviewed articles published in the Korean Journal of Radiology. This recording has been created and submitted by the authors and may have been generated using AI tools. While the article has undergone formal peer review, this audio has not been verified or edited by KJR. We encourage listeners to also refer to the published article for the most accurate and complete information.
Imagine like a tiny ticking time bomb inside your brain. That's kind of what an unruptured aneurysm can feel like for a patient. It's a pretty scary thought, right?
Mm-hmm.
And while these weak spots in blood vessels are, well, surprisingly common, treating certain types can be really, really tough. Today we're doing a deep dive into a fascinating medical innovation. It's designed to handle those particularly tricky ones, a new device called FloWise.
That's right. And our deep dive today, it's based on a solid piece of research, a prospective multi-center clinical study. It was just published in the Korean Journal of Radiology. This study took a really close look at the safety and the effectiveness of this FloWise flow diverter, specifically for treating those unruptured wide neck intracranial aneurysms. So we're going to unpack the device itself, get into the study's design, the findings, and really explore what it all means for patient care moving forward.
Okay. Our mission here is to pull out the most important insights for you, maybe give you that aha moment about this treatment, and help you understand how innovations like FloWise are, well, changing neurovascular medicine. Let's jump in. So, just to start with the basics, for anyone listening who might not be sure what exactly is an intracranial aneurysm, what do we mean by a weakened spot?
Yeah, think of it like a small abnormal bulge, almost like a little balloon forming on the wall of a blood vessel inside the brain. This happens because the vessel wall is weaker in that spot. Now, many people have them and don't know it, but if one ruptures, that can cause a very serious, often life-threatening type of stroke, a brain hemorrhage.
And that's the core challenge, isn't it? Because we've had treatments like endovascular coiling for a while. They have, well, limitations, right?
Yeah.
Especially for certain kinds of aneurysms.
Exactly. Coiling means filling the aneurysm sac with tiny platinum coils. The idea is to block blood flow into it. But for some types, especially those with a wide neck, meaning a wide opening where it connects to the main blood vessel, or very large or sort of complex-shaped aneurysms, coiling just isn't always effective enough. With those types, you often see higher rates of recurrence. The aneurysm can sort of reopen or grow back around the coils, and that means more procedures, more risks. For these tricky ones, coiling sometimes felt like, well, not a permanent fix.
Okay, so coiling had its issues for these complex cases. What came next? What was the big leap forward that really changed things?
Well, that's where flow diverters came onto the scene, and they really represented a paradigm shift in how we think about treating aneurysms. It's a totally different approach. Instead of packing the aneurysm itself, these devices are placed inside the parent blood vessel, right across the aneurysm's opening. Their job is to gently redirect or divert blood flow away from the aneurysm sac.
And how does that work? If the blood flow is diverted, what happens to the aneurysm itself?
It's quite elegant, actually. With less blood flowing into the sac, the blood that's already trapped inside starts to clot. It thromboses. Over time, this clot essentially seals off the bulge from the inside, and the blood vessel wall can then remodel and heal around the device. It's like the body fixing itself with a bit of help from the technology. Now, what's really interesting here, especially with FloWise, is the specific situation in Korea. Getting existing flow diverters widely used there has been tough. Mainly because they're very expensive. In fact, the national health insurance in Korea often only covers them for the really large aneurysms, those 10 millimeters or bigger.
Wow, okay. But most aneurysms aren't that big, are they? So that leaves a lot of people out.
That's the critical point. The vast majority are smaller than 10 millimeters. And this is precisely where FloWise, developed by Taiwan Medical at Taiwan, aims to make a difference. Its primary goal was to lower the production costs, make flow diversion more accessible, more affordable within Korea. Think about it before this. Potentially, many patients with smaller but still dangerous aneurysms might not have had access to this kind of advanced treatment purely because of the cost. FloWise could open that door.
That's a really significant goal, and the device itself sounds pretty sophisticated. What are the key features? What's it made of?
Oh, it's definitely a feat of engineering. It's made from 48 strands of incredibly fine nitinol and platinum wires. We're talking 0.001 2-inch wires, thinner than hair. These wires are braided together and then heat treated. This allows the device, which is like a mesh tube or stent, to expand once it's in place and cover the aneurysm neck. The mesh provides pretty high surface coverage, about 33% to 41%. That's key for diverting the flow effectively. It also has other important properties.
Yeah.
Good visibility on X-ray, acceptable foreshortening, meaning it doesn't shrink too much in length when it expands, which helps with precise placement and a high radial force. That means it pushes outwards firmly against the vessel wall, creating a good seal. Plus, it comes in various sizes, diameters from 3.5 to 5.0 millimeters and lengths from 10 to 30 millimeters, so it can be tailored to different vessel sizes.
You mentioned something earlier about resheathing. That sounds important for the person doing the procedure, the neurointerventionist. How does that work?
Yes, that's a huge practical advantage. The delivery wire has a special silicone coating. This allows the neurointerventionist to deploy the device up to about 70% of its length, check the position, and if it's not quite right, they can actually pull it back into the delivery catheter, reposition it, and try again before fully releasing it.
Ah, okay. So more room for adjustments.
Exactly. It gives them much more control and precision during placement, reduces the chance of misplacing it. And another thing, it's compatible with smaller microcatheters, those with a 0.021-inch inner diameter. That makes navigating through those tiny winding brain arteries easier, better maneuverability, better trackability for the neurointerventionist.
Okay, so they developed this promising device. How did they go about testing it rigorously? What was the study setup?
Right, so this was a formal clinical trial. It was prospective, meaning they planned it in advance and followed patients forward in time. It was multi-center, involved 7 different hospitals across Korea. It was also single-arm, meaning all enrolled patients received the FloWise device. There wasn't a separate group getting a different treatment for direct comparison in this study. And it was open label, so both the patients and researchers knew which treatment was being given. A pivotal study designed to provide key evidence for potential approval.
Got it. And who were the patients in this study? What kind of aneurysms did they have?
They enrolled 70 patients. The average age was around 59, and it was predominantly women, 54 women and 16 men. Between them, these patients had 93 unruptured intracranial aneurysms that were targeted for treatment. The median size was 5.2 millimeters, so mostly in that smaller range we talked about, although the sizes did vary quite a bit, from 1.6 up to 26.1 millimeters. And crucially, these aneurysms met specific criteria like having a neck diameter of 4 millimeters or more, or a dome-to-neck ratio less than 2. These are markers for those wide neck, more challenging aneurysms where fluid diversion is often considered. And the study had very specific goals or endpoints. The main one for efficacy, seeing if it worked, was achieving complete aneurysm occlusion at the 12-month mark. That's defined as Raman Class 1, which basically means angiography shows no blood flow getting into the aneurysm sac anymore. They compared this result against a preset historical benchmark value of 56.7% occlusion.
Okay. And what about safety?
Safety was paramount, of course. They looked for several key things. Any stroke on the same side of the brain causing significant disability, what they call ipsilateral stroke, with an NIHSS score of 5 or more. Also, any new neurological problem causing moderate to severe disability, death within 30 days, and whether the parent artery itself narrowed significantly, 50% or more stenosis, or became blocked by the 12-month follow-up.
And how long did they follow these patients to collect all that data?
The follow-up was quite thorough. Patients had check-ins at 1 month, 3 months, 6 months, and finally at 12 months. That 12-month visit included a final catheter angiography, which is the gold standard imaging, to really see what was happening with the aneurysm and the treated blood vessel.
It sounds incredibly delicate working inside brain arteries. Can you walk us through what the actual procedure to implant FloWise involves?
It absolutely requires specialized skills. The patients are under general anesthesia. The neurointerventionists, these are highly trained specialists, could be neuroradiologists or neurosurgeons with interventional skills. They start by accessing an artery, usually in the groin, like for many catheter procedures. They navigate a series of catheters up through the body's blood vessels into the arteries supplying the brain. First, a guide sheath, then an intermediate catheter closer to the target area in the brain. Then, that very thin 0.021-inch microcatheter is carefully steered across the neck of the aneurysm within the parent artery.
And that's when the FloWise device itself goes in.
Exactly. Once that microcatheter is perfectly positioned, the FloWise stent chosen in the right size for that specific parent artery is pushed through the microcatheter. It's then deployed very carefully so that it fully covers the opening, the neck of the aneurysm. It basically reconstructs that segment of the artery wall.
Okay. And what happens immediately after deployment?
That's a crucial phase. They perform what's called flat panel CT imaging right there in the operating room. This gives them an immediate look at how the device is sitting against the vessel wall. If they see any gaps, if it's not perfectly flush, they might perform balloon angioplasty. This involves inflating a tiny balloon inside the stem briefly to press it firmly against the vessel wall. Making sure you have good wall apposition, as they call it, is really important for the device to work properly. This was done in about 28.6%, almost a third of the procedures.
I see. Sometimes needed to get that perfect fit.
Precisely. And in some complex situations, maybe a very long aneurysm or bridging between vessels, they might even deploy more than one FloWise device, overlapping them slightly. I think the study mentioned up to 3 were used in one particular patient.
And medication must play a big role too, right? Preventing clots around this new device.
Absolutely critical. Patients were put on dual antiplatelet therapy, typically aspirin and clopidogrel, for at least 5 days before the procedure. They continued this for 6 months afterwards and then usually switched to just aspirin long-term. They also did testing to check if patients were responding properly to the clopidogrel. And if, during the procedure, they saw any signs of acute clot forming inside the stent, they had medications like terofeban ready to administer immediately to quickly thin the blood.
Okay, so a very careful multi-step process. After all that, let's get to the results. The big question. Did FloWise work? Was it effective?
Well, the results were certainly impressive on the efficacy side. That primary goal, complete aneurysm occlusion at 12 months, was achieved in 81.2% of the target aneurysms.
81.2%. How does that compare to what they expected?
It was significantly better. Remember that predefined reference value was 56.7%, so achieving 81.2% was statistically superior, with a p-value less than 0.001, which in research terms means it's highly unlikely this result happened by chance, a really strong positive signal. And another key point, the technical success rate was 100%.
Meaning they could always place the device successfully.
Yes. In every single case attempted, the neurointerventionists were able to deploy the FloWise device as intended. That speaks volumes about the device's deliverability and handling. Also, even if not fully occluded, 95.7% of the aneurysms showed at least a 50% reduction in volume, so a significant positive effect across the board.
Those are really striking efficacy numbers. Okay, now let's pivot to safety. What did the study find there? Any major concerns?
The major safety outcomes were actually very good. Importantly, there were 0 instances of those severe ipsilateral strokes we talked about, and no deaths occurred within that initial 30-day period.
That's great news. Were there any serious adverse events at all?
There were some, yes. Overall, 6 patients, which is 8.6% of the group, experienced what were classified as serious adverse events. 4 of these were considered related to the procedure itself, not necessarily the device. For example, there was one very unfortunate case where the internal carotid artery ruptured during the balloon angioplasty step. Tragically, that patient did not recover well and had severe disability and MRS score of 5. Other procedure-related events included things like visual problems, though one patient did partially recover from that. Importantly, only 2 events, just 2.9% of patients, were classified as possibly related to the FloWise device itself. They also noted some asymptomatic narrowing stenosis of 50% or more in the parent artery in a small number of patients, 4.3% at the 12-month follow-up. This didn't cause symptoms, but needs monitoring.
And what about less serious side effects?
Yeah, there were more common, milder things like headache, some nausea, occasional skin rash, which you can sometimes see with these procedures or medications. But these generally resolved on their own.
Okay, so definitely strong efficacy. And while there were some serious events, most seem related to the procedure itself, and overall safety looked pretty good. Why do you think FloWise performed so well in this study? What were the key factors?
That's a great question. It likely comes down to a combination of things. First, as we discussed, that ease of deployment and the ability to resheath it. That really helps the neurointerventionists achieve optimal placement. Precision is key. Second, the physical characteristics of the device itself seem well suited for the job, that high radial force to hold it open against the vessel wall, and the dense mesh coverage to effectively divert flow. And third, the standardized procedural steps used in the study. Things like doing that immediate flat panel CT after deployment and using balloon angioplasty when needed to ensure really good wall apposition. The researchers highlighted that good apposition is a known predictor of successful aneurysm occlusion. So, good technique plus a good device.
Right, the whole package. And how do these results, that 81.2% occlusion rate, stack up against other flow diverters that are already out there and being used?
That's an important comparison. When you look at the literature, the results from this FloWise study seem very much in line with or even slightly better than, some other major studies of commercially available flow diverters. For instance, you mentioned the SHIELD study earlier, which reported about 71.7% occlusion, and the SAFE study showed around 73.3%. So 81.2% compares quite favorably. It suggests FloWise is certainly a competitive technology in terms of effectiveness.
That's really encouraging. Now, you mentioned earlier as a single-arm study. Are there any other limitations we should keep in mind when looking at these results?
Yes, definitely. It's always important to consider limitations. The main one, as you said, is that it didn't directly compare FloWise head-to-head against another flow diverter or even coiling within the same study. It relied on comparison to that historical benchmark value. Also, the average aneurysm size in this study, around 5.2 millimeters, was a bit smaller than in some of the pivotal trials for other flow diverters, which often focused on larger aneurysms initially.
And why does that matter?
Well, smaller aneurysms sometimes tend to occlude a bit more readily with flow diversion. So it's possible that the 81.2% occlusion rate seen here might be slightly higher than what you'd see if you applied FloWise exclusively to a population of very large aneurysms. It's just something to keep in mind, and likely an area for future research looking at FloWise specifically in larger aneurysms.
Okay, that makes sense. So bringing it all together, what's the main takeaway for you, our listener? We've dug into the FloWise flow diverter, seen the study results. What's the bottom line? It really seems like FloWise offers a very promising, safe, and effective option for these challenging unruptured wide neck aneurysms. And importantly, this study highlights how homegrown innovation, like FloWise from Towong Medical in Korea, can potentially tackle real-world healthcare issues like cost barriers. It's not just about having effective treatments, but making them accessible, right? This shows how targeted R&D can meet specific regional needs and maybe bring advanced care to more people.
Absolutely. And if you connect this to the bigger picture, it raises a really interesting thought. This kind of innovation, driven by local needs in this case, the cost and insurance situation in Korea makes you wonder, doesn't it? How could a greater focus on developing medical technologies locally, tailored to regional circumstances, contribute more broadly to global health equity? Could we see more democratization of advanced medical tech if more regions took similar approaches to develop affordable, effective solutions for their own populations?
That's a fascinating question to ponder. What other complex medical technologies could become more accessible worldwide through localized innovation? Something for you to think about as you go about your day. Maybe it sparks some curiosity to look more into medical device development or the challenges and opportunities in global healthcare access. Thanks for joining us on this deep dive.